Good afternoon, ladies and gentlemen. We'd like to welcome you out to the End Men and Stop Medical Apartheid in Minnesota Jails press conference held by Be Their Voices and Shea Perry, the mother of Hardel Sherrell, who died a torturous death in Beltrami County Jail. We're here to demand that the state of Minnesota in all contracts with Men Correctional Facility, who is in 45 of the 81 counties in Minnesota. So we're gonna bring up the mother. My name is Trent Cruz. I'm with Black Lives Matter Minnesota. I'm gonna bring up the mother of Hardel Sherrell, Shea Perry, who is the founder of Be Their Voices.
Thank you, Trent. Thank you, everybody, for coming out. I really appreciate that. As my brother said, I am Shea Perry, the mother of Hardel Sherrell, who on September 2nd of 2018 took his last breath inside of Beltrami County Jail on the floor after suffering, medically being neglected, abused, and who knows whatever else had happened to him in those 9 days that he was in custody, crying out for help. No one would answer his cries. I am also the president and founder of Be Their Voices because other families saw me out fighting for justice for my son, and they reached out and asked if I could help them. Surely I could not deny them. We started this organization on September 2nd of just last year, and I am grateful for the things that we have done as of passing the Hardel Sherrell Act and several other things that we are currently working on with the DOC. However, we are here today to demand that men come to an end, and they must be shut down now. Men is not only here in the state of Minnesota, they are also in Wisconsin, Illinois, Iowa, South Dakota. They cannot continue this rampage of killing our babies and senseless deaths. It must stop now. We need the community. We need your support. We need you to tell them it is time to end men. I will not even call Todd Leonard Dr. Todd Leonard because he doesn't deserve the title as such. Because no doctor who has taken the oath to save lives would allow what happened to my son to happen. And other families who have also lost their lives, their loved ones' lives behind bars. Tony May Jr., Stephanie Bunker, Bruce Lundmark, Naja Khan Powell, even though he was not under the care of this evildoer, Todd Leonard. It must stop. We must have really good medical care, at least provide them with the basic medical care while they're incarcerated. I appreciate all of you coming out today, and I thank you so much for all of your support. Thank you again.
Hardel Sherrell, say his name.
Hardel Sherrell.
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 Beltrami County Jail also needs to be bulldozed and closed down, and the guards who watched Hardel Sherrell lay on the ground for 8 hours should be arrested and sent to jail. Dr. Todd Leonard also should go to jail for murder and lying. Dr. Todd Leonard told a nurse, say that he swallowed a sock and that's why he died, instead of acknowledging that they didn't provide him with the care that he needs. Men says on their website that they can help jails with liability. Well, they do that by lying about their ability to offer care to black and brown bodies that are in their care. So we want the state of Minnesota to end all the contracts that it has with men immediately.
Yes.
Stephanie Bunker was found hanging in a jail in Beltrami County Jail. Tony May was found dead in Beltrami County Jail. Hardel Sherrell was found dead in Beltrami County Jail. There have been at least 5 people, 5 deaths in Beltrami County Jail. There's actually 55 active investigations inside jails right now, and a lot of those jails are where Dr. Todd Leonard does business. So coming up next, we're gonna ask Brandon to come up and say a few words and read a letter from the NAACP. Duluth chapter.
My name is Brandon Tullock. I'm just going to read a letter from the Duluth chapter of the NAACP. On October 2nd, 2021, the Duluth branch NAACP demanded an end to the use of MEND correctional care in Minnesota's correctional facilities and disavowed the exploitative practice of mixing profit and incarceration. MEND has received more than $51 million from Minnesota taxpayers since 2008 in exchange for providing personal and a healthcare system in local jails. Since its inception, the company has spent its time and resources maintaining its professional image and leaving a paper trail of alleged services rather than sufficiently treating patients. It is a company that is all surface and no substance, as was Todd Leonard's intention from the beginning. It is an extension of his misconduct. Todd Leonard is the founder, director, and only doctor working for MEND, presumably presiding over the company's medical practices. Once before, Todd Leonard had his medical license restricted by the Minnesota State Medical Board for unprofessional boundaries, incomplete and illegible records, and improper prescription and monitoring of painkillers. Instead of learning from the experience, Todd Leonard decided to institutionalize his negligence and misconduct with the creation of MEND Correctional Care. Between 2008 to 2015 alone, in the jails it has contracted with, MEND has, through negligence, been responsible for the death of at least 25 people. MEND relies on creating an illusion of care and has been caught falsifying records, lying about the credentials of its staff and the validity of its medical surveys, and has repeatedly and negligently ignored serious symptoms and medical conditions of the patients it is contracted to care for. Employees of MEND and their partners in both correctional facilities and the Department of Corrections have demonstrated a repeated history of attempted cover-ups in regard to their negligence. Todd Leonard and his institution have also repeatedly lied about the psychiatric qualifications of his staff. Beltrami County has ended their contract with MEND, and other counties are following suit. Todd Leonard and his institution are unfit to practice medicine. Ending MEND's contracts is not enough. Ending Todd Leonard's medical license is a must. In its failure to provide competent health care in correctional facilities, Todd Leonard consistently violates the 8th Amendment right of every person incarcerated in Minnesota's correctional facilities. Nobody is safe in Minnesota jails with MEND. Nobody is safe with Todd Leonard serving as the healthcare director.
Thank you so much. Thank you, Brandon.
So MEND says that, thank you, Brandon, and thank the Duluth chapter of the NAACP. And we see the police pulling up right now, and they're coming. The police need to pull up to Todd Leonard's house and hold him accountable.
Yes.
The police need to go to Beltrami County Jail
Yes, that's
and
right.
hold the guards who watched Hardel die for 8 torturous hours on the floor. They need to go up there and make some arrests right now and stop harassing peaceful protesters.
Yes.
Right? We're just here to demand justice for Hardel Sherrell, Tony May, and the 55 other people who have died in Minnesota jails because of a lack of proper medical care. We're going to bring Tashira Galloway up. MNA. Oh, sorry. We're going to bring representatives from MNA, Minnesota's Nursing Association, up. They've been supporting Shea Perry and Be Their Voices since April. Give them a round of applause.
Hi everyone, my name is Mabel Foley and I also have Jeanette Rupert here with me. We're both registered nurses and this is very, very, very hard because when you take time not just to look at the video, but you look at the documentation and then you see that this is not an isolated incident and that this has happened several times over within Minnesota. And you see that this individual still has had the rights to practice. It saddens me personally because I strongly believe most individuals get into the profession of healthcare because you actually care about people. Because, as anybody can tell you, nursing, just like a lot of other professions, it's a thankless job. Just like being a physician, you don't get into this expecting people to thank you for the care that you give, and the expectation is just because this person doesn't respect you or you don't believe in anything that they do, you don't have the right to withhold the health care. Hardel Sherrell was seen by several providers before he died.
That's right.
Several people saw him, and I am so appreciative of that nurse practitioner that was brave enough to not be afraid of this corporate healthcare system to do the work. And then also Ms. Shea as well, to continue to advocate, because this happened in 2018 and she has not had the opportunity to grieve at all. She hasn't had the opportunity to grieve because she has not stopped fighting, because she's not just fighting for her son, she's fighting justice for every individual who has not just died. 55 individuals have died. But we don't know those who have been harmed. We don't know those who have all of adverse effects, who don't have health care now. And that is why our union, when we heard about this, sadly, 3 years afterwards, we had no problem supporting them formally, because we're not just going to stand in the background and give our condolences. We're going to stand in solidarity with Ms. Shea, with every community member, because this is something that needs to end. And I hope sincerely that the board of physicians takes the next steps to ensure that the accountability is done, because we as healthcare professionals, by every state and federal law, we have standards that we have to abide by to ensure that if we do, by either whether it's neglect or if it's malpractice, that we are held accountable. Because the thing is, this is not just something that you just do. You have education, there are reasons, if you don't know, there are ways to ensure that you can reach out to another entity to get the knowledge to do the work that needs to be done. And I am going to continue to stay here, support you. My union, our union supports you, and we will be here because we need accountability.
Yes, we do. Thank you so much, you guys. Thank you so much.
My name is Jeanette Rupert. I'm a M&A member, Minnesota Nurse Association member as a nurse. I am also a board member and volunteer with 612 MASH. 612 MASH stands for Minneapolis All Shall Heal. What happened to Hardel Sherrell is unimaginable. This mother is going through the unimaginable. There's no way that this mother should be standing here with no child. There are other mothers and fathers and family members and loved ones out there who have an empty seat at the table at every holiday, every birthday. Why? Because of the neglect and the maltreatment that was done at the hand of a healthcare professional and the hand of a system in healthcare that has repeatedly caused harm to black, brown, you name it, BIPOC bodies.
Talk about it.
When is it going to stop? When is it going to stop? Unfortunately, as a healthcare professional, I'm embarrassed because it doesn't have to be. That is a poor representation of the oath and the care that we swore to give. It's got to stop. Systemic racism is every system, and the healthcare system is no exception. And men needs to be held accountable. This physician needs to be held accountable. Guillain-Barré syndrome was something that Hardel had, GBS. It could have been treated. That's what people don't understand. It could have been treated at the earliest onset when he was saying, hey, I don't feel good. Guillain-Barré syndrome, it's an autoimmune syndrome. It attacks the nervous system. So as it's attacking his nervous system, it moves up that paralysis that he was feeling in his legs. You guys seen the video. It didn't just all of a sudden happen where he just couldn't breathe. No, that was gradual. It happened over time. And caught early, he could have had immunoglobulin therapy. He could have had plasmapheresis. There could have been therapies and treatments to help him be here today.
That's right.
But because of the lack of intervention by a healthcare professional, it wasn't like he got there too late. He had been seen by several professionals. And the jail, Beltrami County Jail, you're wrong. You are wrong. You know better. You know better. And I thank God for the nurse practitioner who stepped in and said something. Because she knew that this inmate's life mattered. Right. I don't care if what they've done, their lives matter. And we have a duty and a responsibility to treat human life with respect. Yes. That physician took an oath to do no harm. In my opinion, harm was done.
Black lives matter. Black lives matter. Black lives matter. We want the healthcare system in the United States to understand that black people are human beings. Black people, if we get shot, it hurts. If we get punched, it hurts. We feel pain. The medical industry in America has experimented or has treated black people less than human for over 400 years, and they continue to do so today. So they try to say Hardel was faking, even though he couldn't get up, even though he couldn't walk. They tried to say he was faking and that he was trying to escape, and they need to be held accountable for that. So we really want America, the state of Minnesota, our criminal justice system to understand and respect black people's humanity. We are human beings, and we need to be treated like that.
Yes.
Coming up next, I'd like to bring Shea Galloway up. She has been really supporting Shea Perry throughout this ordeal, and she also has been supporting families who are victims of police brutality. Give her a round of applause.
Again, my name is Shea Perry. I am the founder of Family Supporting Families Against Police Violence, and I stand against this corrupted system. Whether Hardel died on the streets or whether he died inside of a jail cell being neglected as a human being, it is a system that is intact, that was designed and created to keep a certain group of people under oppression.
That's right.
And that happens to be black, minority, and indigenous people. Hardel died in that jail. We watched a video. We watched a video that was so inhumane. The way they picked his body up and threw him over into the bed like he was nothing. I have sat with Miss Delshia and listened to Hardel as he pleaded for help. And he was asking his mom to contact the people within the jail to help him. How could they think that he was faking? How could they think that this was a game? Why? Because there's no value for the black man's life.
That's right.
That's why. There's no value for any person that is not a privileged Caucasian person. That is why Hardel died the way he did, and we must call it out for what it is. Yes. We must not sugarcoat it, and we must just say the truth. The truth is, he was not a privileged white man. He had made a mistake like any other human being. There's not one person standing out here that has never made a mistake. Allegedly. He didn't even get his chance in court. He didn't even get his day in court. Just as George Floyd and the rest of these people didn't get their day in court. So we are here to say the inhumanity and the lack of regard for human life has to stop. And that starts with men's medical.
Yes.
That doctor failed to do his job. Why should he still be out here being paid? Why should these people still get a check when we lost human beings? We lost human life. Is human life not more than these people's paycheck? Than a dollar bill?
Yep. Profit over lives.
Profit over lives. They're getting their paychecks while this mother doesn't have a son. They're getting their paychecks while those 3 little girls don't have a father. They're getting a paycheck while the rest of the families, the 55 murders, they don't have their children and their loved ones. Enough is enough, and we will not stand for it as a community. We are grateful for everyone that stands with us, but we will continue to be out here in front of Men's Medical until they are held accountable for their part that they played in Hardel Sherrell's murder and all of the rest of the murders. Justice for Hardel Sherrell and all of the stolen lives. Thank you.
Black lives
Matter!
Black lives
Matter!
Native lives
Matter!
Native lives
Matter!
In Beltrami County Jail, a lot of natives are being murdered and killed. So we got to fight for them too. Coming up next, we have Jonathan McClellan.
All right, Jonathan.
Give him a round of applause. He's been putting in a lot of work for Del Shea and for all of the families, and been showing up a lot lately. So we really respect and honor the work he's doing.
Hello, my name is Jonathan McClellan. I'm president of the Minnesota Justice Coalition. We work with families and community to draft and advance legislation and other policy initiatives at the Capitol in St. Paul and in Washington, D.C. The Minnesota Board of Medical Practice states that their mission is to protect the public's health and safety by assuring that the people who practice medicine or as an allied health professional are competent, ethical practitioners with the necessary knowledge and skills appropriate to their title or role. The Board of Medical Practice consists of 16 residents of the state of Minnesota appointed by the governor. 11 board members must be licensed to practice medicine under this chapter. Men Medical CEO Todd Leonard has been investigated by the medical board, which has called his conduct unprofessional and unethical, end quote, after reprimanding him in 2011. The board said Mr. Leonard failed to keep adequate medical records and had inappropriate prescribing practices while he was in family practice. Fast forward to today, Todd Leonard has left that area of medicine and now runs Men Medical Correctional Care, which has grown substantially over the last 10 years, and as for last year, cared for an average inmate population of 2,700 a day in the states of Iowa, Illinois, Wisconsin, and South Dakota, and Minnesota. Men Medical Correctional Care has contracts with jails across Minnesota to provide health care to incarcerated individuals. Not surprising, as Men Medical has grown, so has the number of complaints and lawsuits filed against the company, many of which allege inadequate care that has led to preventable deaths. Records show this past February, Mr. Leonard's company failed to disclose his company's troubled history when he applied for and won a multi-million-dollar contract to provide medical care for inmates in Anoka County Jail.
That ain't right.
Because complaints involving a doctor's license are handled in secret, it is unknown whether evidence concerning other suspicious deaths involving Mr. Leonard's business were part of that hearing. Profits over dollars. Here are 2 things we do know. 1, since 2015, records show at least 25 inmates have died where Men Medical was the care provider. And 2, in the last 10 years, Minnesota counties have paid out nearly $13 million in settlements and legal fees following lawsuits accusing jails of providing inadequate to non-existent health care to inmates, with many of those cases involving failed well-being checks. This is information the public needs to know. If this was any other public license, it would be revoked. The licensing board has an obligation, and that is to protect the public. A person's humanity is not sacrificed just because you are incarcerated.
Yes.
The incarcerated deserves the same level of care as everyone.
Yes.
Even though the Hardel Sherrell Act passed with legislative change, the licensing agency has failed as of this date to protect the public, which is part of their charter. The board needs to revoke the licenses of Men Medical and Mr. Leonard.
Yes, yes.
We demand the state of Minnesota Medical Board of Physicians follow their charter and hold to account Men Medical Healthcare, Mr. Todd Leonard, and other negligent providers. If they are unable, unwilling, or absent-minded, we ask the governor to replace these board members
Yes,
he
yes.
appointed.
Yes. Yes.
Shea Perry has worked tirelessly with the Department of Corrections to advance reforms to ensure that there is not another Hardel Sherrell.
Yes.
The Hardel Sherrell Act of 2021 passed with unanimous support and was signed into law by Governor Walz on June 29, 2021. However, there's still a lot of work that needs to be done.
Yes.
The public should not have to have their voices holding this medical board or Mr. Leonard accountable. The board was created to protect the public, and that is their job, a job which they have failed as of this date. Until this is done, we will be their voices and continue to hold them accountable.
Yes.
Thank you.
And like Miss Galloway was saying, Hardel and many others didn't get their day in court because they died in jail as they were being processed. So we're looking forward to seeing Mr. Leonard, Dr. Death have his day in court for murder. We're also looking forward to seeing the guards who allowed Hardel and others to die have their day in court
Yes.
for murder.
Yes.
And we're going to stay out here until that happens. We're going to bring up Toussaint Morrison, and he's going to talk to us about Hardel and ending Men Medical Facility.
When we talk about Hardel Sherrell, I want to go to the start, and that is where Hardel was born. Hardel has a black mother, and if we go back to his mother, who is Miss Shea Perry, we have to look at that African American mothers are twice as likely to have an infant who dies by their first birthday. We have to look at infant mortality rate that occurs in the black community is higher than any other community. We have to look at structural racism in healthcare and social services that are a means to African American women often receiving poorer quality than white women.
That's right.
You cannot separate healthcare from racism. You cannot separate the hospital from racism. You cannot separate Todd Leonard from his practice from racism.
That's right.
This is an act of racism. This is an act of negligence. This is an act of malpractice. And I'm being generous when I say malpractice because that brother was practicing nothing at the time.
Exactly.
Because somebody doesn't have a roof over the head doesn't mean that they're not human. Because somebody has an addiction doesn't mean that they're not human. Because somebody is in jail or prison doesn't mean that they're not human. In this society, we have a pattern of condemning people, simply throwing them away and discarding them, no longer considering them. Hardel was a human whether you liked it or not. Dr. Todd Leonard has a history of considering people not human whether you like it or not. And he must be held accountable. I go back to my mother, who was a cancer nurse, a clinical oncology, clinical specialist nurse at HCMC. If anybody came in, even if they didn't have cancer, you treated the pain.
Yes.
Oh, they want more morphine? Let's talk to them and treat the pain. Ms. Shea sent me a list of all the people that tended to Hardel. There is a list of people that all need to be brought to task.
Right.
And what's more, they're getting paid for it. They're still employed, they're still making money off of this, and this is in the history of the United States. Lack of medical care to black people and black communities profiting off of it. You show up alive on arrival in South Central Los Angeles, you would die in the waiting room. You show up in jail alive in Beltrami County, you will die in your cell. And not only will they not hold anybody accountable for it, they will continue to make money off the body of Hardel Sherrell. Why is that? Tell me, why do they keep making millions off of his body? At the least, he loses his job. Why is he still working? Why is he still even titled doctor? I'm being generous by using the title doctor. For here on out, I will no longer refer to him as Dr. Todd Leonard. He is just Todd to me. He's nothing more than Todd. That's all he is. He is a millionaire who has profited off of bodies in jail. Think about that. If somebody died on your job operating this camera, you'd be out of the job. Somebody died on your job operating this camera, you'd be out of the job. But yet, Todd is making millions. And the jails are still profiting from black bodies, brown bodies, and poor bodies, and anybody's body in jail. This needs to stop. Todd needs to be held accountable. And just like any institution that has somebody die in their watch, if a bar overserves somebody and they die because of alcohol poisoning, they go back to every bartender who served them and they hold them accountable. Every CO, every person working in that jail, every doctor that saw to Hardel Sherrell needs to be held accountable.
Yes.
They picked up his body like it was a sack of potatoes and threw it in the gurney. They cared nothing for that man, but we do. And that's why we're here. And we're going to continue to show up until some respect is put on his name and he's treated as a human. And there is some justice brought to Todd going forward. Say his name.
Hardel Sherrell.
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 Justice to Hardel Sherrell and all power to Hardel Sherrell, and let there not be another Hardel Sherrell, and let there not be another Todd working, making millions off the bodies of incarcerated people in the state of Minnesota, let alone this country.
Please give him another round of applause, because this is Hardel Sherrell died from systemic racism, and so did a lot of Tony May, Stephanie Bunker, and a lot of other people who died in Beltrami County Jail, in other jails that are operated by Men Medical Care. We're gonna bring Brandon back up, and he's gonna hit us with some powerful poetry.
So before I get into the little bit of poetry and end with the chant, I just want to say we're here talking about the systemic racism that black, brown, and indigenous people are faced with. And yes, we're here talking about what happens to people in jail with the medical care that they receive, but people always want to talk about when we see videos of black men, black people being killed in the street at the hands of the police, or why don't they just comply? Why don't they just listen to them? Because you need to realize that if you go to jail when you still have yet to be convicted of a crime, you can be killed in jail due to medical negligence.
That's right.
Yes, absolutely.
So when people say, why do you fear this? Why do you just comply, blah, 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 that could lead to your death.
That's right.
Absolutely.
That could lead to your death. So that goes into the reality that we face. So I'll do a little bit of writing that I have, and I'll end with a chant. So, you think my fear is irrational every time I see them flashing lights. But I gotta do what I gotta do to make it to another night. And all I got is fight or flight. And we've been fighting for hundreds of years, so running is all I got left. But look what white folks did to Ahmaud Arbery. And look what the police did to Dante Wright. Y'all say his fear is irrational, but they're the ones who took his life. So his fear of being murdered by the police should be justified, right? Well, cops fear for their safety too, but somehow that ain't an issue. Well, now how do I know if they can tell the difference between the gun and the taser that they're issued? Just comply, just comply, just comply. But there's no way to count all the ways that I can die. Because no matter what happens, the police can always lie. We have to protest for them to release the footage that they hide, and all the reports can easily be falsified. Do you know what happens to black bodies in police custody? Hardel Sherrell does. Naj Powell. So does Sandra Bland. Eric Lurie knows that they can torture you uninterruptedly. Maybe Khalif Browder can help you understand why I'm not listening to no police commands, cause I'll be damned. So now I just need y'all to repeat after me. Say rest in peace to Hardel.
Rest in peace to Hardel.
Nobody should die in jail.
Nobody should die in jail.
Say rest in peace to Hardel.
Rest in peace to Hardel.
Nobody should die in jail.
Nobody should die in jail.
Beltrami County, go to hell.
Beltrami County, go to hell.
Nobody should die in jail.
Nobody should die in jail.
Beltrami County, go to hell.
Beltrami County, go to hell.
Nobody should die in jail.
Nobody should die in jail.
Say men to medical, go to hell.
Men medical, go to hell.
Nobody should die in jail.
Nobody should die in jail.
Say men to medical, go to hell.
Men medical, go to hell.
Nobody should die in jail.
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 Wow. So to close us out, we're gonna bring Tashira Garraway back up and lead us out with the Asada chant.
I want you guys to look at this mother as she breaks down behind us. Look at what they've done. Look at the pain that they have caused. We are not out here for nothing. We are not pleading and demanding this for nothing. They are really hurting our people in the community and in these jails. They are really antagonizing and giving maltreatment to human beings. It doesn't matter what we look like. It doesn't matter what we have or what we don't have. It doesn't matter what you think we did wrong as a human being. Nobody deserves this. No mother deserves this. We have a duty to fight for our freedom.
We have a duty to fight for our freedom.
We have a duty to win.
We have a duty to win.
We must love and support one another.
We must love and support one another.
We have nothing to lose but our chains.
We have nothing to lose but our chains.
We have a duty to fight for our freedom.
We have a duty to fight for our freedom.
We have a duty to win.
We have a duty to win.
We must love and support one another.
We must love and support one another.
We have nothing to lose but our chains.
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 All power to the people.
All power to the people.
Thank you. If Hardel don't get it,
shut it down.
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 Thank you.
Tim, before we conclude, are there any questions?
I got a question for Jeanette.
Yes.
Just 1 second.
Nope, that's fine.
Why did the Minnesota Nurses Association take the extraordinary step of purging jails across the state to end contracts with Met Correctional?
I think the Minnesota Nurses Association, we've always stood for injustice and against social injustice. And so I think that we as an organization and as a union understood that it's time for us to no longer just be in the background, but we need to be on the forefront and supporting communities of color. And as my fellow community members have said, that the healthcare system is no exception to racial injustice for BIPOC individuals. So it was very important for us to take more of that visual approach and that visual stance and say, enough is enough. Enough is enough. Go ahead, did you want to add anything?
as Jeanette said, like essentially we always have had this stance as a union. We've always stated that we're against the decorporatization of healthcare, profit over the health of our over the health of a people. But the thing is, we had to take it a step further because we have this initiative that's already out there, but we want to say that we are formally taking a stance against men's health. We're telling every county, all 80 of them, to consider ending the contracts because it's not an isolated incident. It happens time and time and time and time again.
Yes. Yes.
If you don't hold the value in the person that is giving you care, your life should not end. You should not be in this should not happen. I don't even have the words to say it as eloquently as everyone else here, but as a healthcare professional, as a nurse, as a doctor, as an aide, as a behavioral specialist, it is not up to you to withhold healthcare. You don't have that right. And so that is why we took this formal stance. We against another corporate agency because that's what's happening. Because our tax dollars are funding this to happen. And everyone should be outraged. Every healthcare professional should be outraged. And just as Jeanette said, that is why we took this stance. We've always had this stance about the decorporatization of healthcare, but we took it a step further to say specifically for men's health, because it happens time and time and time again. These are the only numbers that we know about. We don't know how many there are until our work triggered the FBI to come in and do an investigation. So the thing is, we have to continue to hold them accountable, and not only in Minnesota, but in Iowa, in Wisconsin, in the Dakotas, and also in Illinois. We're not going to stop. And our union is going to continue to stand in solidarity with Ms. Del Shea, the rest of the community, and we're not going to stop. Because if we do stop, then they're going to continue to neglect us. They're going to continue to use our taxpayers' dollar money to do whatever they want, and it should not be.
Let every state know. Watch what we do here in the Twin Cities. The whole nation's eyes have been on Minnesota now for quite some time. And for you to stand by in your own state, in your own city, in your own area, communities, and do nothing, the Minnesota Nurses Association is standing up. Take notice. No matter what state you live in, this is not isolated to Minnesota. Wake up.
Yes.
Wake up.
Yes.
This has been happening for centuries to BIPOC individuals. Take a stand. Unions across the nation, organizations in healthcare, take a stand. So 612 MASH and Minnesota Nurses Association continues to stand and fight for justice in healthcare. Thank you.
Thank you. I just wanted to say my last words. Thank you so much for coming out. And as everybody's been saying, it's time to take a stand because it's time to end men. We cannot continue to just stand by and allow this to happen. Because what if this were your son or daughter? You'd be out here like I am too, fighting tooth and nail. My life came to a complete halt 3 years ago, but they've been able to go on with their lives as if nothing ever happened. Enough is enough. Enough is enough.
Enough is enough.
End men now.
End men now.
End